I think we're in this period of this unbelievable breakthroughs in science and understanding disease, and we talked a little bit about personalization of medicine, really each individual understanding exactly what's going on for themselves. So it's in some ways it's an amazing time. At the same time, the ability to see how you can invest in those areas and get a return, the kind of what a lot of innovation and entrepreneurism and in the capital markets, and it's a very difficult time. The cost that it takes, the time, makes it fewer people are wanting to invest. So I think what I'm worried about is kind of all this potential of really being able to make some major changes in human health, especially in a personalized manner, at the same time that we're not quite sure how we're going to be able to realize these breakthroughs, and how also as a society we can afford them. And I think it's going to be one of the biggest challenges that we all have in this sector going forward. So that's what worries me the most.
Well, if you're up from 12 to 3, I'll take from 3 to 6 because I'm worried about that too. And I think you're absolutely right. We are on the verge right now of better understanding with the diagnostics, and we need to help drug companies and pharmaceutical companies develop these very targeted drugs that can be so powerful. And the thing that I see, because we work with patients all the time, where targeted therapies are making a big difference. And we need to get those targeted therapies and the education out in the hands of the practicing physician, but it's enormously difficult. And some of the things that I think are barriers right now are we're all waiting on the outcome studies. We need outcome studies. But we can't get the outcome studies because we need to get the patients in the clinical trials. Now, we can't get the patients in the clinical trials because we can't get the testing done, because it's not part of the guidelines, and we can't get the reimbursement. So we have a circular conversation going on, and we have to break down those barriers. And I really do believe working with the pharmaceutical companies to get them the patients that they need, to get those outcome studies done, will then eventually get us the drugs that we need. And that's what keeps me up at night.
My worry is probably a little more along the lines that Nancy articulated. I think, speaking as sort of a hospital and worse yet as a specialty hospital, we are enormously concerned about how we are going to meet our missions. If we have 4 missions: care, research, education, and training, care and community investment. How we're going to continue as an academic medical center to meet those missions and reduce our costs sufficiently to continue to provide access to some of the most complex and specialized care. So we need tremendous scale, and which just, it's a horrible way to say it, but we need a lot of patients in order to take care of the very sickest patients. And what we're finding as people try to reduce the cost of healthcare is they only want to send us the very sickest patients because we are generally a little more expensive. We only take care of kids. We can't spread our costs among adults. And as people try to create narrow networks, I'm sure some of you have heard of these, or closed systems like Keep Care within, we'll use Steward. I hope no one here works at Steward as the poster child, as they try to keep everything that they can take care of within that system and only send the sickest patients to Boston Children's. We will struggle in a very parallel way to continue to be innovative, continue to fund research. And we need to also invest in things that will reduce utilization. So here we are trying very hard to change care delivery pathways, to experiment with different kinds of care delivery, but we reduce our revenues by doing that. And the way that payers pay, so the need for change has accelerated much more quickly than payment reform has kept up with that change. And so we are actually really concerned.
To follow up on Wendy's point about financing healthcare, healthcare is a sector of the economy for us as investors on the crossroad of commerce and ethics. So to be able to balance those two, do good and do well, is not always that easy. So this is one of the challenges as an investor that we have. The second one that it's totally different environment in the Middle East or an emerging market. The challenges are very basic compared to here. They are very much more on new regulation, political, public policy, and how this is affecting reimbursement and coverage. This is changed so fast, so quickly, without any warning or logic sometime, that is very difficult to be able to always, be an investor in this environment. Of course, there's amazing opportunities, but also it's a lot of risk. And licensing and bringing qualified healthcare professional to emerging market is another challenge that is so difficult. So, this is some of the challenges we face in emerging market healthcare.
Do you want to add anything?
Yeah, in the vaccines world, it's very complex. It's much more complex than the pharmaceuticals and therapies that are developed for people that are ill. In the vaccines world, you need to vaccinate a population. The population is healthy to prevent disease. The diseases are out there. Some of these diseases don't live in animals. You don't get them, through vectors. You are the carrier of those bacteria, and you pass them on to your children, to your friends, and so on. You get debilitated a little bit, and they invade you, and you die, or you get mutilated. And we develop, we're at the point where we develop these vaccines for these unmet needs, and it would take to vaccinate the entire population, and health economics doesn't pan out without in addition to all the obstacles, FDA approval and so on, that pharmaceuticals have. Vaccines need recommendations from a body that meets at CDC, that is composed of experts and physicians. And these recommendations usually don't pass if there is not a health economic that justifies the vaccination. So if a disease that could be eradicated through vaccination, through a vaccine that is effective and is safe, may not get that far because there is not a recommendation for a routine vaccination in a certain population. So I agree with all of you. There is a very complex landscape out there. There is a lot of competition between different therapies and opportunities to prevent disease. And, there has to be some common sense about, how can you go about these therapies and what is the compromise that you can get to so that you can eradicate a disease that lives in humans.